Okay, so I'm very pleased to be joined by David Wells, the Chief Executive of IBMS. Thank you, David, for your time. Give us an idea of how Congress is progressing this year.
So, well, feedback so far has been that it's absolutely fantastic. We're about a third bigger than usual, so we've got about 3,200 delegates already booked. And here, and we've got about 1,000 people coming in just to see the trade show. So it's got our biggest and best yet, I think. 400 lectures across sort of 19 different lecture tracks, and I think definitely there's a palpable buzz from our membership, and we've got a good engagement with both our members, exhibitors, the education program, everything. So I think it's one of those things we probably say it couldn't have gone better so far.
That's really fantastic. Yesterday you launched the long-term biomedical science workforce program. Give me an idea of how important that is going to be for the IBMS and for the biomedical science profession going forward.
So I think the key thing is, in the workforce plan that's been published by NHS England early in the summer, it left out biomedical scientists in both in terms of mentioning a profession that's a key part of diagnostics within healthcare, but it also missed out in terms of data and numbers of trainees, and I think that was difficult for us as a profession, and I think we needed to put forward something that actually filled the void to explain what we do, why we do it, and how we do it. All the work we're proposing to go forward in our series of pledges is all about making sure that biomedical science training and education is fit for the future. We know that healthcare is changing massively, we know that we have an ageing population, we know that we have skills gaps across the healthcare system, we know that there are fewer medics remaining in key disciplines within pathology, and we think that our biomedical scientists can fill that gap. Right from support workers coming in, for people doing their undergraduate degrees, get them through that training program as quickly as possible without losing any of the quality, and then moving forward into their specialties right up to the advanced practice that we see very successfully in histopathology and cytology. So I think it really sets out a credible plan that the Department of Health and Social Care and NHS England can take. And I'm also hoping that the devolved nations also take it on board and say, okay, well, what can we do to support this? So what I will say as well is there's nothing revolutionary in that as well. All the things that we've said we are going to do, we can do, and we know we've got a track record of doing as well. So it's that credibility as well that goes with that. And I'm hoping that if we can get enough groundswell support in delivering that, then we'll see a profession that really does meet the needs of our country.
Okay. Another thing the IBMS has increased its focus on in the last year is your lobbying approach, taking on a lobbying firm. Can you talk more about how that's worked for you over the past 12 months and the potential there for the future?
It's the same thing as the long-term workforce plan, isn't it? It's being able to get our voice out there to explain to people, decision makers, policy makers, people in power, what is the value of biomedical science. And when we talk about biomedical science, we talk about it in this broader sense. So not just the biomedical scientists in the laboratory, but also industry, the impact on innovation, the speed of adoption of new innovation, making sure that we've got the right people in the right places within the healthcare system and the wider supporting environment. So people, when they look for solutions in healthcare, and we do need to have some seismic changes in the way the NHS and healthcare is delivered, some of those solutions will come from our members. And some of those will come from a situation where people are saying, let's get diagnostics done earlier, let's get them out of the laboratory, but let's make sure we do them in a way that's completely safe and supports patient pathways. And how do we also add into that when we're talking to stakeholders? It's about saying to them, did you know pathology is not just a black box that sits halfway down the patient pathway. In fact, it can sit right at the top and the entrance point of your pathway. So when, again, ministers are sitting there saying, what can we do to reduce ambulance conveyancing, improve cancer outcomes, to improve waiting times, these are things our members can help do. And so talking to them to say, did you know that this workforce exists? Did you know that this technology exists? And did you know the impact of that is such? And that's what we're hoping that work does. And I'll add into it, it's not just talking to them, we're also doing the work around what we call strategic research, so looking at the value that biomedical science and biomedical science brings into the wider UK health economy, so that we can start to really evidence that. So not just being able to say to ministers, aren't we great, we can do this and we can do that. It's saying, but here is the evidential value of that, and here's the financial value of that, and here's the impact on patients as well. So it's a very long-term piece of work to get our name up, to get us recognised, get us around the table, talk to the power group, people in power and leading strategy to start the conversation about how we make changes. And I think that's what we're after.
Excellent. Yesterday, the IBMS President Deborah Paget spoke very passionately about inclusivity and representation within the IBMS as well. You've already mentioned this is the largest congress you've had yet. Give me an idea about how the IBMS is and its membership is changing and progressing.
Well, so we know that our membership is very different to what it was when we were created 120 years ago. We now have more women as members in terms of the mix. We know that we have a very ethnically diverse community of people working in biomedical science, and we've got to make sure that actually when we talk about EDI, it's absolutely central to what we do. So we don't actually come out with a particular statement and say, well, a work stream about how are we more inclusive. We embed it fully into everything we're trying to do. And that fits also with the new HCPC standards. It fits with, like you mentioned, our membership. But also going further forward into delivering equitable healthcare, we can understand better about what it is to be equitable across the board by just making sure that everything we do is a reminder to how to be a more inclusive environment. Now, that doesn't mean that we, like I said, I've very inside in particular things, but we do have an EDI group that's led by our council member, Tamina Hussain, and I think that's making great strides and making us think about things, just stopping and thinking about where do we hold meetings, where are the social events, who are we including when we're running an online meeting, what other things we need to think about in terms of making it more accessible. If we're running in-person meetings, how to make those more accessible, to be considerate about those things. Now, I think everyone will see that that's an important part of what everyone does, and so we don't make it a separate piece, we make it as just pure part and parcel of what we're doing every day.
Yeah. David, that's fantastic. Thank you very much for your time and congratulations on a wonderful event here at Congress.
Thank you very much.